integrative functional medicine nutritionist, and she's certified by the IFM and nutrition and as an IFM certified practitioner. And she's also an expert in fertility, and that's not a topic we've ever had here on our webinar. So I'm really excited, Annina, for you to come on. Thanks so much for coming on. So functional nutrition for fertility and pregnancy, as we normally do, we will discuss today about community updates a bit. So I'm not going to go through this whole list, but you can watch the recording later. These are the visits we're doing either virtually or in person right now. And there are many things in person, there are many things virtual, but this is kind of what we're doing. So I just want to give everyone an update on that, whether you're watching this live or you're watching the recording later. This is a helpful kind of slide in terms of what we're doing in the clinic here. COVID updates, we usually just kind of are updating here the vaccine timeline for the rollout for Maryland, Virginia, and DC. So you see that everyone's now in phase 1B, which includes healthcare workers, essential personnel such as teachers, firefighters, police officers, and then age greater than 75 and older for Maryland, Virginia, and then 65 and older for DC. So there's some links there you can to be notified about things. You can click on those links depending on where you are. I did want to say one thing, which is that there was some research that was recently done in last week, trying to keep updated every week from Rockefeller New York University in New York City, that shows that the memory B cell response to the SARS coronavirus 2 virus lasts for at least 6 months. So that's good news for those of you who have unfortunately got infected, but have survived this, and your immune system is stronger for that. So even if the antibody levels go down in the blood, the memory B cells, and I think also the memory T cells are likely going to be proven to be have a robust response even longer than 6 months. But so far, it's been a 6-month study, and that's published in Nature. So you see the link there. And I do think that, and we can talk about this later if you want, Annina, since you're an integrative functional nutritionist, but they did a study as part of that Rockefeller study that showed that half of people with COVID-19 symptoms actually had colonization of their guts, of their GI tract. So, there is some thought about, does COVID get colonized in the gut, and then that causes long-term fatigue for people, or longer-term fatigue and other systemic symptoms. I wonder if it's being kind of sequestering in the gut a bit. Here's our upcoming schedule. So Annina's on today. We have Dr. Kim and Bear on next week talking about functional dentistry and oral health. And we have Shannon and Jade coming on sound healing and yoga. I'm looking for that as well. Starting into February, Rebecca Wong, no relationship to me, but a herbalist and acupuncturist, and she's in Toronto. She's going to be talking about traditional Chinese medicine and herbal therapies there for general health and general and specific questions that people may have. And then Dr. Carrie Jones is on, which Annina and I both know pretty well, is the medical director of the Dutch test, and she's going to be talking about hormones again, as the second time we're doing that with her, in February 18th. So Liz Reese is going to be talking also. Liz Reese is our heart math instructor. We have group visits that Jen can put in the interest from the link chat. If you haven't heard of this yet, this is an amazing group that we're doing with Liz Reese here, and we're going to be talking about de-stressing the nervous system. All right, so I think I'm going to stop the share and hand it over to Annina here. I've known Annina for a long time here, good friends here, and been really doing a lot of the functional medicine and kind of sharing notes back and forth. Annina, just real quickly, maybe just introduce yourself. I did give you a little bit of intro, but how did you get into functional medicine and functional nutrition?
Sure. Thank you, Dr. Wong. I appreciate it. My name's Annina. I'm a registered dietitian and a functional nutritionist. I have a PhD. And I got into functional nutrition, I think, the way many of us do, in that I wasn't getting answers from the conventional medical system. So even, in my 20s, I had surgery and I had some thyroid issues, and I was just looking for other answers. And that's how I really kind of got into functional medicine, looking at the root cause of disease and trying to figure out what was going on instead of just trying to treat the symptom, trying to figure out what the problem is. And I grew into the fertility space. I've been a functional nutritionist for 9 years now in private practice, but I really enjoy working with the fertility patients and pregnancy patients and new mom and babies, because I felt like this is an area of care that's missing for a lot of women. We don't have specialists that really specialize in natural fertility in our conventional medical world. We also don't have specialists for pregnancy, like how you support women in pregnancy. Their nutritional needs change dramatically, and OBs aren't trained and they often don't have the time to work with women on that. And the postpartum period is a really difficult period for many women. And as a mom, I went through that myself. And you have tremendous demands with breastfeeding, as well as the incredible change you have when you have a new baby, just on your body physiologically, but also emotionally as well. So that's how I got into that space, and really wanting to provide that care for other women that I saw that was a gap in my own experience, but also in many of my patients.
And that's a valuable service too, because health really starts in the womb, preconception, during pregnancy. That's, in a way, we can argue that's the most important time to focus on health. That's really a deep level of prevention there at right at birth and before birth. So yeah, thank you so much for doing that and being of service there. Have you found that working with the conventional specialists, that they're open to some of the things that you're doing with fertility and pregnancy using functional medicine? Or
I think somewhat. I think there's some apprehension. I mean, I think, as many people might know, your conventional medical doctor doesn't even have to receive an hour of nutrition training in his or her
that's pretty
entire
sad.
medical
Yeah,
career.
yeah.
So there's a recognition that diet's
Right.
important, but just how important nutrition can be, I think, is not kind of always fully understood. So,
Yeah.
people will refer, but it's understanding what I'm doing and what I'm working on, and the extent that you can actually impact. As you said, Dr. Wong, I mean, egg health has tremendous outcome, not just in terms of being able to get pregnant and stay pregnant, but for the health of your baby in the future. So if
Yeah.
it's less chromosomally abnormal,
That's right.
your baby is more likely to be
Really
healthier.
setting that person, that baby, up for life, with good health, with doing that. And I will have to say, Dr. Twain's on here too. Dr. Twain is our new doctor here, but we both went to Tufts Medical School, which has a school of nutrition, a good school of nutrition, although I do think it's fairly conventional. We definitely had to learn nutrition afterward, after school was out. But that's great. Well, welcome again, and I think you have some slides, right?
I do. So I'm going to share my screen now. And just let me know that you guys can see it okay. Here. Okay. And everyone can see it. So as Dr. Wong mentioned, my name is Annina. I founded a practice called Simplina. And he was asking me earlier, how did you come up with the name Simplina? And really, the idea is to simplify the process and make it easier for women when they're trying to get pregnant, to know the information that you need to know about natural health, integrative health, functional medicine, to get pregnant, to stay pregnant, and also as a new mom with a baby. And so that's where the name came from. And I'm happy to talk to you today about fertility and pregnancy and how you can optimize your health. I do want to also mention that even if you're not trying to get pregnant right at this moment, your nutrition matters now. The more you can set yourself up for optimal health, the better your outcome will be and your chances will be of conceiving. So it's never, too early to start taking care of your health. And the only thing that side effect you can get is better health, which is what I love about what I do.
That's a great message, right? Yeah.
So yeah, as I mentioned, I founded the organization Simplina, and we work on women's health. That's always been my area of specialty, but particularly in fertility, pregnancy, and for new moms. So one of the tenets I think that's really interesting in functional medicine is really kind of looking for a root cause. And I like this quote because it says, "Look and you will find it. What is sought will go undetected." And about 40% of women get a diagnosis of unexplained infertility. And what I would say from a functional medicine perspective is nothing is fully unexplained. There's always an answer your body might not have. It might not be the only answer. It might not be the only cause. But when I start digging in and look at thyroid health, adrenal health, immune system function, gut function, nutrients, I usually find something in every patient. And the thing for fertility is your body needs to be fully ready and optimized and have a lot of energy production in order to produce a healthy egg, in order for conception to occur, and in order for that embryo to grow and implant. So what we do is really try to look at what else is here in your history, your genetics, that we could find answers to when you might get a diagnosis of unexplained infertility, or we're not sure why you're having difficulty conceiving. So I do want to have a little quiz. I know Jen's going to just pop this up and ask people if you have trouble with sleep, regular menstrual cycles, meaning your cycles are not regular, maintaining a healthy weight, or all of the above. If people could take just a few moments or a minute to answer the questions on the quiz.
I have a question while people are answering. Do you feel like during the COVID-19 pandemic that people's sleep, weight, and menstrual cycles have been affected, the people, the clients that you see, or people that you know?
Yeah, so I think it's one of those things that people kind of overlook. Like, I don't sleep well, but I haven't slept well in a long time, or I've never slept well. I've had patients who've
Mhm.
never really slept for the night,
Right,
always woken twice.
right.
But
Yeah.
that impacts your melatonin production. Melatonin is a powerful antioxidant for fertility.
Mm.
It
Yeah.
also would, your cortisol production, if you're spiking at night, can lead to blood sugar dysregulation, which can impact insulin, and as well as your ability to then moderate your hormonal system. So that can impact your
It's all
hormonal
connected.
balance.
Yeah. Yeah.
All
So,
right. So we
oh,
have
mm,
some people have trouble with sleep. If you ever sleep, regular menstrual cycles, maintaining a healthy weight, and all of the above. It seems like most of us have experienced one of these symptoms. And the point of the quiz is really that each of those symptoms can be a symptom that could impact your fertility, as Dr. Wong was kind of getting at. So sleep is really important. I can't underestimate that enough. So often we think, oh, that's just a side thing. It's not. We know that people who don't sleep well, if we control for every other factor, their BMIs are higher. So even if we control for diet and exercise, they'll have a higher body mass index just because they have dysregulated sleep.
and
Um,
that affects their hormone. Yeah. That affects
that's
them.
right.
Yeah. Yeah.
It impacts their hormones. Regular cycles. So I think many women, might not have had regular cycles early in life. And the common response in the OBGYN community is to put people on birth control pill, even if you don't need it for birth control, just to regulate your cycles. When you're trying to get pregnant, it's really important that you're ovulating, the estrogen is surging, the progesterone comes up after that ovulation, and that happens on a regular basis. And it could be 28 or 32 days, but it should be regular for you. Irregular cycles are a symptom of hormonal imbalance, and I'll talk a little bit more about that. And certainly weight, if you have a hard time maintaining body weight, so you do need a certain amount of fat for estrogen and estrogen production. And then you also, if you have excessive amount of weight, that can dysregulate the hormonal balance as well, and that can disrupt, estrogen can become too high, and it can suppress the progesterone and therefore suppress ovulation as well. All right, so moving on. So I just talked about how these three areas can impact fertility. So what is infertility? So it's defined as not being able to get pregnant after 1 year of unprotected and timed sex, and that time part is important. So making sure that you are having intercourse when you are ovulating, that is key. And in women over 35, it's 6 months, just because the time is more of the essence. And so that's the clinical definition of infertility. About 10% of women have trouble getting pregnant or staying pregnant, and that's a CDC stat. That we think some of the real numbers are higher because it's hard to gather that data. But infertility is an issue, and it's also on the rise. So in 2017, we had the lowest rate of fertility basically since we started keeping records in 1917, in about 100 years. And there's a number of reasons for that. One is advancing age. More women are older when they do try to conceive for the first time, and they're getting pregnant later. Lifestyle factors. So having a chronic disease risk factor, so whether it's prediabetes, excess weight, other issues, can actually inhibit your ability to get pregnant and stay pregnant. The environment, and I can't stress this enough, plastics, estrogen mimickers, BPA, all of these have impacted our hormonal cycles, as well as overdriving estrogen. And that's a big issue. And that's a lot of personal care products too, your conventional shampoos and soaps and so forth. Male health. So, I think so often in the IVF world, the focus is on the woman, because the treatments are really focused on women. The idea is if a sperm test is okay, motility and sperm count is somewhat normal, they kind of write men off. But you guys need to remember that men are 50% of the equation. Sperm health is absolutely
Yeah.
essential. So what your partner does, how he lives, whether he smokes, his exercise level, if he's carrying a cell phone in his pocket all the time, that matters. And there's actually better data on male infertility on the rise than there is for female, just because it's easier to study than it is to study egg quality. And also there's an issue of the role of long-term birth control use. So IUIs, IUDs, women on the pill for 15 years, vasectomies, or people are reversing vasectomies later in life. That's also contributing to the infertility stat. So from the functional medicine perspective, what do we look at? So look at genetics. So, having SNPs, MTHFR mutations is one example. Lifestyle, how you're living every day. Hormonal balance, what do your hormones look like through that whole cycle? And Dr. Wong and I have talked about the Dutch cycle mapping test. It's a full month that CAH does. I also do it. It's a great way to look at like what's happening in a full month, not just on one day, but how does your cycle balancing out? Thyroid adrenal health. Thyroid is very important for fertility. Most conventional IVF clinics do test for TSH. They usually don't go beyond it, but that is very important for maintaining the metabolism that you need to have good embryonic growth. Stress hormones and cortisol production, sleep, energy, biotransformation and elimination, your immune system, and nutrient insufficiency. And as I mentioned earlier, I haven't had one patient that has necessarily a perfect profile of everything. There's always something that I can find. And a lot of us think I eat well, I can't possibly be deficient in something. And I think when we start testing and not just guessing, we find otherwise. So a standard fertility workup is really, when you go to a clinic, they'll, whether it's before IVF or at IVF, they'll do a basic TSH, they'll run a CBC, they'll run an AMH, looking at your ovarian reserve, and they might do an HSG. And then after you had, and unfortunately in the conventional system, it takes like 2 or 3 miscarriages or failure to conceive with multiple cycles of IVF before they really do more extensive testing, looking at progesterone, your full genetic screening panel, and also doing more diagnostic testing like hysteroscopy, transvaginal ultrasound, even endometrial biopsies. But whereas in functional medicine approach, the idea is like, let's do a lot of this testing up front if we can. Do a full hormone panel, do a thyroid panel. So CAH does a great job. Their thyroid panel is really extensive, right? You're doing 3T3, 3T4, you're doing thyroid peroxidase antibodies. I mean, Dr. Wong and the practitioners there are looking at your full profile, and that's something that we want because your TSH could be normal, but other things could not be. Doing an iron panel, looking at your immune system, anti-nuclear antibodies, vitamin D3 has been shown to have an impact in fertility. Your hemoglobin A1C and how well your blood glucose is functioning over time, as well as an AMH. For functional labs, I use Vibrant America, and I also use SpectraCell, and I know CAH, you do that as well. And that gives you that full panel of nutrients. And that's really important because we can't, through LabCorp, test all the nutrients that we would like to test. We can do some one-off ones, B12, B6, vitamin D3, but we can't get the full panel. And you really need that full panel because each of those nutrients and minerals, those vitamins and minerals, play a role in your body's metabolic function, and they all have a role to play in energy production, which ultimately is important for fertility. I do recommend the GI map test, which I know CAH does as well, and the Dutch test, and looking at your genetic SNP. So there's a number of ways you can do that. I mean, you can do it ancestry.com and you can convert it, or you can do it through some of that testing through LabCorp as well. And then diagnostic testing. I'm big on having transvaginal ultrasounds just to see if you have polyps. Do you have polyps in the uterus? Do you have polyps on the cervix? I mean, those little polyps can inhibit fertility, and it's something that we want to know. You don't want to wait 2 years into trying to conceive to find out that's actually the problem. It's actually a mechanical issue, and something like that can be removed. Or if you have blocked fallopian tubes, it's good to know that upfront. There's things in natural health too that we can do to enhance that. So it's a different approach to fertility and functional medicine. And I would say, one thing to think about is this whole concept of biological age. So, I think so often if you go into an IVF clinic or you talk to your OB, they're like, you're over 35, you're high risk, your chances of getting pregnant drop off dramatically as if you just jumped off a cliff between 34 and 35. And that's not really the case. There is a shift, but you have to remember that's based on a lot of other data. And that's based on an average and an average within the standard American population. So we talk about a nutrition standard American diet, where there's also, you're pulling an average from the full population. And then it's not looking at your biological age. So we all know people who they look like 30 when they're 40. And then there's the people who are 40 but look like they're 50. And it's not just how you look, but how you are physiologically inside. And that is more of your biological age. And we can do a whole host of testing, but also it's just really good living and how you live your life to reduce your biological age. So your number will still go up, but you don't advance in age as rapidly as you do with the age of the number in which you are. So I thought it was just important to talk about biological age and how it's determined. And it's determined by telomeres, which are the nucleotides at the end of chromosomes. And if you're in the fertility world, you hear a lot discussed about chromosomes and chromosomal abnormalities, which are a cause for infertility and repeated miscarriages. So basically, these telomeres dictate how quickly cells age and die. And the higher your age number is, the shorter your telomeres. But actually, a healthy lifestyle can reverse aging by lengthening those telomeres. So not only can you, kind of reduce the aging process, but you can even reverse it in some cases. And I wanted to show this slide because this is Vera Wang on the top. And if you see her, she is 70, and this picture was taken when she was 70. Below is a picture of a woman who is 70, she was categorized as age 70 on, on Google. But the difference in the aging process is tremendous. And so DNA methylation, I think many of us have heard about MTHFR, genetic SNPs, which I mentioned, and methylation. So cells use DNA methylation to control gene expression, and it can turn genes off. And so it's really important that you want to turn like the bad genes off and have chromosomal stability. And there's different things you can do with diet and also targeted nutrient support if you have certain genetic SNPs to reduce that aging process. So what do I do for my patients? Well, the thing is, even though I'm just a nutritionist, I don't just do nutrition alone. I do exercise, I do sleep, mental health, work on the environment, cleaning and greening the environment, and also finding a sense of purpose, because your mental health, not just in terms of the support system you have, but also your purpose in life beyond just having a kid or being a mom or so forth. Having this world outside of that is really key. So I'll give you a case study. I had a 37-year-old who came to me, and when she came to me, she felt like she was, so fragile. I felt like if I could touch her, she would just crack. She was in tears. She had this massive binder of all her health results. She had been to 3 different IVF clinics. So over a period of time, she had heavy periods, long-term birth control use. She had 5 failed IVF cycles by age 37, 3 miscarriages. She had low ovarian reserve. She had an AMH around 0.3. She was iron deficient. She was slightly elevated TSH. She had tested negative for celiac, and she was told by the last clinic that there was no option for her to conceive, which I think is heartbreaking for any of us to hear that. But I also don't think it's the role of another practitioner to always tell you what your future options are. And because there is possibility when you really take care of your health, and what that possibility will bring, we don't know. But I would never rule anything out, whether it's any health condition, heart disease or cancer or infertility. So I did blood hormone testing. This was before I was doing the Dutch test on day 3, 12, and 21. Ladies, if you are getting blood hormone testing, you really want to make sure it's timed. I have so many patients that come back to me and they were doing progesterone on day 3 or an estrogen on day 18. It has got to be timed appropriately if you're going to do the blood hormone testing, or else it's really useless. A Chem 14 thyroid panel, iron, looking at her blood glucose, her hemoglobin A1C, a celiac panel again, because those numbers can change depending on people's exposure to gluten. So if they're gluten-free, celiac panel will come back negative. They start eating gluten, then you can see it turn positive. And then looking at her genetic SNPs. So I had this full program for her set out. So we removed gluten permanently. Even though she was negative for celiac, there's a lot of evidence that glyphosate, which the US uses, it's a genetically modified product in its wheat production, can harm fertility because it kills bugs upon eating it. And so the question is like how it's actually working in the gut. And there are some long-term studies looking at its negative effects going on right now. A higher protein, lower carb diet, you really want to balance that blood sugar. You need to have a really nice insulin control. Electrolytes and water intake. So that's really important for cervical mucus production and also nutrient absorption. So often my patients are drinking a lot of water, but they're not getting the electrolytes, that's sodium and potassium. And the sodium and potassium need to be balanced just at the right level to allow nutrients to get into cells. And also for good cervical mucus production, which you need to conceive. It's also very important for men for sperm motility. Supplements I put her on were prenatal with methylated folate. She did have one of the genetic SNPs for MTHFR, mitochondrial support, so that's ubiquinol, D-ribose, PQQ, and egg health includes the ubiquinol as well. Probiotic and chromium. And chromium is really for good blood sugar control. It's a mineral that used to be abundant in our soil, but as we do topsoil farming, it's become deficient. Many of us become deficient in it, and it's really important for balancing blood glucose, and it's an easy way to do that. I reduced her high intensity Orange Theory workouts. I have a lot of patients who like a lot of high intensity exercise. It's not ideal when you're trying to conceive. You want to make sure you don't alter your cycles, and certainly stop bleeding as well, but just the high intensity is a little bit too much. And doing stress reduction and support. As I said, she was really fragile. She literally felt like she was going to fall apart. And so really getting her into a good therapist, finding a support group. There are plenty of free support groups for infertility and miscarriages in this area alone. So it's something, and now they're all virtual, so they're pretty easily accessible. Greening her personal care products, that's just getting the synthetic chemicals out, and sleep hygiene. And so before someone's trying to conceive and trying to get through the detox process, I'll sometimes prescribe tryptophan and calm, which many of you know with the magnesium, and that can be helpful for sleep. So she had 7 years of infertility struggles. After 6 months of doing everything that I had asked her to do and being part of our program, she conceived naturally. And she actually went on to have a healthy pregnancy with no complications and vaginal delivery. She had a full-term baby girl. Again, that was after 5 failed IVF cycles and 3 miscarriages. And I'm so happy for her. And she's a mom, and I work with her now on breastfeeding and feeding her baby and introducing new foods. I'll just quickly mention a second case study is a 32-year-old patient of mine who tried 3 years unsuccessfully trying to conceive. She had a failed IUI, she had a miscarriage. She also had a lot of heavy bleeding, and that doctors hadn't really looked at as a potential cause of hormonal imbalance before. With her, I did the 30-day Dutch hormone testing. I did the basic blood workup, the Chem 14, thyroid panel, iron panel, hemoglobin A1C. I did the GI map, listening to her and her partner talk. Her partner traveled extensively around the world to a lot of developing countries and had parasites in the past. And so it's really important that your gut function can impact your nutrient absorption as well as your hormonal balance. So we wanted to see if there were any issues there. And again, looked at genetic SNPs, MTHFR, COMT, and other ones that can impact fertility. So for her, I did an elimination diet, removed dairy and gluten permanently for the time that she's trying to conceive. I did seed cycling, which is how you have different types of seeds at different points of your cycle to support estrogen and progesterone production. So she was dominant in estrogen, and she was surging way too early in her cycle and not producing enough progesterone. What I like about seed cycling is it's a natural way to try to balance hormones. And an organic diagnostic working group, Dirty Dozen. So if you can't afford 100% organic all the time, completely understandable. But looking at a diagnostic working group website is really important. They have a Dirty Dozen of foods you should absolutely not be eating, and conventional, grapes being one, apples, strawberries, and so forth. And so really avoiding those, making sure those are organic. And then adding fermented foods. She had dysbiosis in the gut. Luckily, no parasites, but a decent amount of dysbiosis going on for both her and her husband. And so they're both on fermented foods and probiotics to really support gut health. I had her do PDG testing for ovulation, which you can do on day 21 to day 22, and to look at whether that progesterone is surging enough to ovulate, to have ovulated. And in the beginning, she wasn't. Now she is. And so that's a good thing to know. You don't want to be trying to conceive if you aren't actually fully ovulating. Electrolytes and water intake, supplements, Vitex. Many of you might know there's chasteberry extract with the hormonal balance. That's a gentle way to work on that excess estrogen and progesterone without really creating too much of an imbalance in the system. Prenatal with methylated folate. That's a standard recommendation I make for anyone who's thinking about conceiving in the future or trying to conceive now. So with the blood clotting and the excessively cloudy periods, fish oil and curcumin in the first half of the cycle only, mitochondrial and egg health support. So moderate running, again, another type A, a lot of excessive cardio exercise. So really trying to slow that down a bit, and then having yoga, some slower movement, walking, You want to kind of reduce the cortisol reduction. You don't want to kind of keep it peaked throughout the whole day. Stress reduction with meditation apps and hypnotherapy, which I find can be really effective in really getting people to deeply calm down and relax. Greening her home and personal care. So she was a teacher and she was working at home. She had laptops all over the place. So ladies, no laptops, and men too, right on your lap. You know, and you should have EMF protective coverings around your phone, underneath your computer, and turning off your wireless at night is important. Good sleep hygiene, and also a roadmap. I think when someone's younger, the IVF clinics are like, you know, you can just try IVF and go from IUI to IVF. You don't really know where you're going to go next. It really helps patients to know, you know, what next. And for us, what we decided is we're going to give her 3 months to change things before she starts trying, and then another 6 months to try. And we'll tweak things along the way and see where that takes her. So clinical pearls about fertility. Our existing health symptoms can be a sign of underlying issues. They simply expose imbalances in the body, and we notice them because we're trying to get pregnant. It's on the rise, partly due to decline in health and advancing maternal age. Utilize functional medicine to look for other answers, how well your body is functioning. Utilize everything that's available to you, conventional lab testing, functional testing. Your provider should be doing a detailed case analysis of your story, and get diagnostic testing early. Don't wait, you know, for third miscarriage or 2 years of failed IVF cycles before you get all the testing that you need. Just get it up front and figure out if is that the issue. And you have to ask your doctor for it in a lot of cases and push for it. Remember, optimal health equals lower biological age, and a personalized health program incorporates changes that can reduce your genetic risk and be targeted just to your genes. And the nice thing about natural fertility is it opens up possibilities without any side effects. Very quickly now, I'm going to talk about pregnancy, and then we'll open this up for questions afterwards. So pregnancy, one thing we all have to understand is that your nutrient needs increase, and the food you eat is the main source of nutrients for the baby. So it is really important to have a well-nourished, balanced diet when you are pregnant. You have additional needs, so calories, you need more food total. You need calcium, you need vitamin A, vitamin C, D, B6, B12, and folate. And if you have the MTAs HFR or some genetic SNPs, you could not be getting the folate that you need, the B6 or the B12. So that's why it's really important to have methylated versions of those supplements. I do want to just mention pregnancy and weight gain. I'm always most concerned that my patients are gaining weight. I'm not too worried about the excessive weight as long as it's not too much, but you've got to be gaining enough weight to get those nutrients to the baby and also for your own supply. So if you are not eating enough, what happens is that your body goes and pulls those nutrients from the bone, from your blood, to utilize because it needs that. And that makes you deficient. And there's a risk for that in pregnancy and complications in labor and postpartum if that continues for a long period of time. So the functional medicine approach to pregnancy is you're really doing a full panel. Again, the functional testing that I mentioned, as well as the regular labs, diagnostic testing. If you're already pregnant, I'm not a fan of excessive using of diagnostic testing, including ultrasounds. If you need to do a standard ultrasound, that's great, but you don't want to use ultrasounds excessively. There's some data to show that it could be harmful if used excessively, so we don't want to do that. So I just want to mention that to patients as well. And just go back. So as I talked about, we have the basic care plan. And then here's a case study. I had just this past August, a 41-year-old come to me at 15 weeks. She had gestational diabetes. She had rheumatoid arthritis, elevated body mass index at 29.8. She was iron deficient, and she was also vegetarian. She had hypertension, and she had hyperthyroidism. So she had a range of issues that were going to put her at risk for carrying that pregnancy fully, as well as potential complications that could exacerbate in labor and put her at risk for preeclampsia or so forth. So I did a full panel. We did some nutrient testing for her. I did Genova just because she was remote and that was an easier thing to do, and that's a urine test. And we did look for MTHFR. So we ended up putting on a high protein, higher fat, complex carb, nutrient dense diet. Even though her BMI was higher, if we can do higher protein and lower carb, we can kind of level some of that excess weight gain, but you get the nutrients that you need, and you need good quality fats and you need good quality protein. So, low fat or not eating enough is not an option when you are pregnant. Avoiding the dirty dozen, as I mentioned, having organic protein and reducing gluten. I didn't eliminate it for her because these were a lot of changes for her to make, and she would have pretty much a standard American diet. Electrolytes and water, which are very important in pregnancy. Having a prenatal of methylated folate, because she did have the genetic SNP. As I mentioned, 40-60% of the population does, so it's really common. Chromium to really balance that blood sugar. Gamma-linoleic acid to work with the rheumatoid arthritis. Her doctor who was working with her on rheumatoid arthritis wanted to keep her on high dose medication. We were able to do gamma-linoleic acid at a decently high dose, and she was able to wean off that medication, which is always better for a baby and mom if you can handle it. Probiotic, liver capsules. So she was iron deficient and she was vegetarian, and she wasn't crazy about eating meat. She did eventually start eating some red meat. But she took liver caps, and I like liver caps versus just regular iron, ferrous sulfate, because that can actually get toxic in high doses, the synthetic iron, whereas when you have it from a natural food source, you don't have to worry about that risk, and it comes with other B vitamins. Vitamin C to help that iron absorption, a D3, she was low in D3 and you need K2 to absorb D3. Choline, very important for baby's brain, and DHEA, also very important for baby's brain. Moderate to low intensity cardio. Remember, she had rheumatoid arthritis, so like mat Pilates, nothing where you're doing a lot of resistance. Even walking for a long period could be painful for her. So bands for strengthening, the physical therapy bands. Again, it's not weights. You're not putting too much pressure on the joints. Stress reduction with meditation, apps, and hypnotherapy. Greening her home. She was working from home. She was pregnant. Really making sure that she had the EMF protection for her pregnancy. So there's shirts that you can buy with EMF protection. Coverage on them for pregnant women, so I had her in that. Sleep hygiene, and the fact that her nutrient needs change by a trimester, so we worked throughout her pregnancy from 15 weeks on, and we changed her supplementation based on that. So that's the end of my talk, and so I think now I'm here to answer any questions that you have, but I wanted to say that if you'd like to make an appointment or you're interested in working with me on fertility, here's my contact information as well.
Great, thank you, Annina. Lisa had a question on irregular cycles. So what have been some of the reasons for irregular cycles in terms of hormonal imbalances? I guess what type of hormonal imbalances would lead to irregular cycles, and how have they been resolved?
Sure. So there's a number of reasons for irregular cycles. It can be blood glucose. So poor insulin metabolism can change that. Stress, cortisol production can change your cycle. Whether or not you ever started with regular cycles. So I have patients who were started on birth control right from the beginning because they weren't cycling. And so their body actually never regulated from a young age. They've been on birth control until they tried to conceive, for 12, 15, in some cases 20 years. So your body had not picked up that process. You can have excess estrogen, and that's more common in our society with all the estrogen mimickers, all the plastic. In America, it is okay to feed animals estrogen and hormones to make them fatter, chickens, beef, pigs. That is banned in Europe and the EU because you are basically taking birth control in and excess hormones when you eat those products. That's why I'm really big on organic meats. I know or grass-fed beef or local versus your conventional beef and dairy for that. And so how have they been resolved? So one is to figure out where you're falling off. And there's a lot of different things that can be part of the reason for hormonal imbalance. It could be progesterone driven, it could be estrogen, it could be just how you could not be ovulating. So doing a Dutch cycle mapping test is important to kind of figure out where you're falling off. And then doing things like herbs that are adaptogens, so chasteberry, which is nice because it doesn't just promote one thing or the other. It has a progesterone-like effect, but it can balance the cycle overall. Seed cycling, you can look that up, where you take pumpkin seeds in the first half of your cycle and sesame seeds in the second half of your cycle is a natural way to help balance hormones. And eating a really clean diet. So I find when I clean up my patients' diets, get the blood sugar under tight control using chromium, a lot of times I can get their cycles to balance out better.
Great. Molly has a question on what are your thoughts on gestational diabetes? I guess that means in relation to fertility, I'm assuming.
Yeah, so I'll go ahead. Yeah, so blood sugar is really important. I can't stress that enough. I think you saw every time I had a case study, I was looking at their hemoglobin A1C, I was looking at fasting blood glucose. Blood sugar and insulin dysregulation can drive changes in cortisol production. It can change your nutrient absorption. It is really important.
So it can affect fertility status, both fertility status and pregnancy health too, right?
That's right, because it changes your hormones.
Mhm.
So it's a risk of infertility because it can change your hormonal balance, and it can your hormones cannot be cycling normally. And pregnancy is absolutely crucial because if there's excess blood sugar, insulin in the blood, that's a risk to the baby. And actually, it can, at a high level, it can put you at risk for a miscarriage or a stillbirth or an early going into labor early. So it's really important to get that under control. The thing is, I've heard patients come back to me where doctors say there's nothing we can do about gestational diabetes. My 41-year-old patient was an example of that. We got her blood glucose, we moved her hemoglobin A1C down within a normal range within probably 6 weeks of hydrochromium supplementation. So you could do something.
Yeah, exactly. I mean, it's reversible with the right life. So I think it's a good point is that now when you did that with that patient, she was able to still eat enough food and enough calories or enough food basically keeping the baby a healthy weight.
Yeah. Mm-hmm.
Great.
Absolutely.
Great. I have a question about methylation since interest of mine. What is methylation, first of all, in general? I think that's a good thing to review for everyone. And then how does methylation and THFR in particular affect fertility?
Yeah, so methylation is the process in which methyl groups are added to a DNA molecule. And that might seem like really esoteric, but basically methylation helps with every function in the body, your cardiovascular function, your immune function, your energy production. It's a really important process, and it regulates gene expression. And so I think all of us know, like, oh, I'm at risk for heart disease in my family because I have family members have a heart attack earlier in life. But just because that risk is there doesn't mean that has to be your risk. And what I love about studying genetics and methylation is there are things we could do with targeted supplementation to reduce that risk. So you can basically stop some of those genes from being expressed with the right products. So like for example, MTHFR, which I talked about a lot. So that's important for fertility because there's evidence to show women with the MTHFR mutation, particularly C677T, have more trouble getting pregnant and they're more likely to miscarry because of high homocysteine levels. And I just lost everybody. So could anyone hear me?
Yeah.
Okay. I brought your screen down so we could see your face.
Okay, I'll exit my full screen. So
yeah, so methylation. So how do you support methylation for fertility and pregnancy?
Yeah, so that's a great question. So the big thing is that you want to have your methylated supplements. So ones get tested. So that's the first thing. I think that's important. But I would say you don't wait 6-8 weeks, just start taking methylated supplements. Like all of your even if you're not on a prenatal right now, should contain methyl tetrahydrofolate. I just think it's a better thing to do around the block. Your B vitamins should be methylated. So adenosyl hydroxy, B12, P5P for your B6. Those are just some basic things that you can support methylation. Detoxification, drinking lots of water. Alcohol inhibits methylation. So, you shouldn't really be drinking anyway, I think, but, really try to limit the alcohol intake because that can inhibit.
That's a good point. Methylation. That's a great point. And certainly all the things you mentioned in the beginning, the sleep, the stress management, the healthy movement, all that will support methylation, getting enough protein. How do we support healthy, Molly got some good questions here. Oh, actually, Ayla, let's do Ayla's first. Ayla said, have you heard of someone passing the pregnancy 3-hour glucose test but still having blood sugar spikes while eating carbs at home? That's interesting.
Yeah, so remember, tests are at one point in time, right? So the fact that everybody does this 3-hour fasting blood glucose at week 22 to 26, that's a point in time. And it's a morning in time too. So if I have patients who are fully diabetic with type 2 diabetes who have great dietary control. They get stressed out and their insulin is off the charts. Wow. So there's a huge stress component that impacts insulin.
Raise the cortisol, which then raises the insulin. Is that okay?
That's right.
Yeah.
So, and it's not a fun test to go in and be stuck at the hospital or the doctor's office for 3 hours drinking sugar
They
liquid
literally
and
could
then
be
waiting.
stressed from the waiting. And yeah,
See if things
yeah.
are abnormal. So, but you could also have a normal test, and then, but your day to day is what matters. And if you're measuring at home, you absolutely could be abnormal, and that day, for whatever reason, was normal. Maybe you worked out the day
So they could be
before.
spiking at 1 or 2 hours, like too high, but then by 3 hours, that curve is normal. So then that might be normal on that 3 hour test.
Right, that's right. So I do think regular testing, whether you're not doing it at home, but your doctor should be regularly measuring your blood glucose. And that's also why I like a hemoglobin A1C on top of a fasting blood glucose to look at that
Mhm.
long-term measure.
And fasting insulin is good too. That's a nice test. It could be nice. How do we support, Molly has another question here. Great question. How do we support healthy telomeres? That's a great question.
So that's a great thing. So they show, like, when we look epidemiologically at populations, so in Japan, you have like the highest number of centenarians in the world, and people live to 110, and they also live to 110 well, which is amazing.
Yeah.
And so you look at what is that picture? So their diet is a very basic diet. It's very alkaline. It's not very acidic. The traditional diet is what I'm talking about. So a lot of greens and seaweed, some seafood, lower on the beef and the dairy side, very low processed sugar, green tea. So the Okinawan diet too. They also have the limestone as well. Huge social support. So you think like, oh, it's all in nutrition, but they find like communities that have a lot of social support, they age really well. And in America, we have one of the highest levels of isolation. Britain too. There's a whole loneliness epidemic, and the current Surgeon General that's being appointed wrote a book on loneliness. And I think it's, and COVID-19 is where
COVID doesn't help
all of
that.
us revisiting that, that does matter.
Yeah.
But so living really well, not just with nutrition and having a non-acidic diet, but having social support, exercise, good cardiovascular health can help.
Yeah. Great. Thank you. We have a couple more minutes here. Let's see. You said you like the ancestry. I won't focus too much on genetics because I know there's a lot more to that. So when should someone start taking, and this is a general question, I think, for pregnancy, but when should someone start taking the multivitamin or kind of getting ready for pregnancy? You said really at any time could be the time, right?
Yeah, I always tell my patients, no matter where you are in the cycle, you should be taking a multi, just as like insurance. I feel like it's like auto insurance. Everyone should be doing that, and with a good quality methylated product. So I know CAH uses those products. I use those products. You're not going to buy them off the shelf. I almost never find methyl tetrahydrofolate even off the
they're not
shelf
going to be
in Whole Foods. It's going to be sold through a practitioner.
Right. Methyl B12 versus hydroxyadenosine B12. You're thinking maybe the hydroxyadenosine more than the methyl B12 for people, or?
Yeah, for especially COMT mutation and even the MTHFR, they don't process the methyl. It doesn't mean you don't need any methyl, but a lot of products have added methyl B12, so you don't have to worry about supplementing that as much as adenosyl hydroxy.
Great. Evelyn said, first of all, Jen said, are any resources for non-toxic personal care products? Because we know that the toxins in the environment are really one of the major causes, I think, of infertility, of the endocrine disrupting chemicals, obesogens that then raise insulin that make it harder too. So what are your resources for non-toxic personal care products? Just a personal question. Do you have any favorites for, skin care, hair care? I know that everyone's interested in that too.
Yeah, so I've been on a long-term search to do this. I use the Environmental Working Group website, and also there's an app called Think Dirty, where it lists toxicity of products. So I have a kelp shampoo from New Zealand.
Oh, wow.
And it's called Living Nature. And I really like those products because I find a lot of products in the US, although they're cleaner, they're not as clean as what you can get from Europe.
They get, the natural products, a lot of them in the US get bought up by these corporations. That's what I noticed is
even Jason's.
And then they get bought up by some huge corporation, and then next thing you know, they have sodium lauryl sulfate in them. But there's still
Burt's Bees got brought up by the people who make Clorox.
Weird,
So there's a lot of products like that.
So ewg.org, Skin Deep, that's the big site.
Right, Skin Deep is environmental, and they rank the products. And you'll see some products, there's no evidence, they don't have the data, but there's usually one in a couple in every category, from shampoo to makeup, that you can find that are.
You like Living Nature kelp shampoo in New Zealand? I didn't know they Is that right? It's called Living Nature.
Yeah, so I don't know. I've just found this great shampoo. It was on Environmental Working Group, and I ordered
Okay.
it, and it actually worked. Because I think a hard thing many of us understand is sometimes the natural products don't work the same
Don't work the
as
same.
the
Yeah,
conventional products. Whether it's even a laundry detergent, you're not going to run around smelling like a laundry room.
Right. Right.
And so you have
Great.
to find like your balance.
Okay, it's a great question from Evelyn. So very low in iron due to fibroids. Have been working on increasing, and I take supplements. Don't really eat beef. First of all, we know that fibroids is usually related to estrogen dominance. There's some inflammatory system going on with the gut, and estrogen, progesterone balance off. But any advice on how to increase that iron? I will say one thing, just medically, you want to get maybe an ultrasound and those type of things. That's what you would consider looking with your practitioner about, just to see how big that fibroid is. But
Yeah.
what's your thoughts on that? How to up the iron there?
So I'm all about the bioavailable form of iron. So you'll hear nutritionists say that, and it means a more absorbable form. And the kind of iron in conventional supplements called ferrous sulfate, and it's synthetic. You actually, in one of my nutrition classes, we put magnets in cereal, and we pull the magnets out, and you can see the ferrous sulfate all stuck to the,
Oh no.
the magnets. Yeah, so that's what you're having when you have fortified cereal. But the key thing is, like, I like liver capsules. I like eating beef, because it's highly bioavailable form. And the key thing is having vitamin C with that. So vitamin C helps the uptake of iron. So you should be having fresh fruit, citrus.
She doesn't eat beef. I think she said she doesn't eat beef. So let's, is there any other sources of iron that you would?
Yeah, so nettle root tea is another great source of iron that's vegetarian and it's very absorbable.
Nettle root tea. Okay, great. What about the chicken, pork, fish? Is there a lot of iron in the other animal proteins, or
no? So the darker the meat, the more iron. So I always tell my patients, if you're going to eat chicken,
dark meat,
or turkey, dark meat. White meat doesn't have any iron. The darker the meat. So that's why lamb, liver, venison, they're really high in iron. And the lighter your meat gets, the cut of it, the less iron is there.
Molasses is supposed to be high in iron, right? Although I don't know how healthy that is, but
yeah, no, it actually is high. It's got sugar in it, but it's also a great source of B12 and B6. So I recommend unsulfured molasses. I put it on my buckwheat pancakes in the morning.
Okay, got it. Toyin asked, okay, so what would you say are the root causes of morning sickness? Is it just the increased hormones and sugar imbalance? And how do you address morning sickness?
So the way I do it is different. So there's a lot of causes for morning sickness, and certainly the changes your body are going through. But the key thing is that your hydrochloric acid in your stomach is down, right? Because your body is dealing with all this hormonal production and growth of the placenta. So the first 3 months are really critical in the growth, and the demands on your body are high. So your blood goes to your extremities, right? Fight or fight, and it's away from your stomach. Hydrochloric acid is lower. And so the biggest thing I do is electrolytes, high dose electrolytes. And if I can get you to have enough chloride and hydrogen, you can actually produce the stomach acid you need to better digest your food. So a lot of morning sickness is you don't have the stomach acid. So your body doesn't want it because it knows that it can't break it down and keep it down.
So what kind of, I'm assuming for a pregnant woman, you wouldn't want to give someone betaine, or do you give them betaine HCl also?
Say that again.
I'm sorry. Do you give HCl capsules to people that are pregnant, or?
So you could do HCl capsules, but I actually just prefer making your own electrolytes, but you've got to have enough sodium. So I feel like my patients always want to skim on the sodium because we hear salt is bad. Yeah. You have to follow an electrolyte recipe. I have my own that I use for pregnancy and labor. Cool. That involves a number of different products, but you have coconut water where you got to have that Celtic sea salt in there.
Oh, okay.
Have it right at the right ratio.
Yeah. Get the sodium, potassium, and all these different things. Yeah, and certainly sodium and chloride. Let's see, make total sense. All right, well, great. I think that's a good point about the morning sickness, about the low HCl. That's really great. Let's see, and certainly, I know probably Tori knows this, but doing that pericardium 6 point in terms of acupuncture, that can be helpful. Things like that can be helpful. Ginger and stuff. What else? I think we're almost up to one. Jen, any other thoughts here? Or I think all of our nutritionists are here too. So any other thoughts here? Maybe Ayla, you want to talk about anything else? This has been a great overview of fertility and pregnancy and how to use functional nutrition to really move the needle, so to speak, on people trying to get pregnant and increase their fertility. Would you ever use digestive enzymes in pregnant women? That's another one.
So I would say no. Digestive enzymes, I mean, they're pretty powerful, and there's questions on whether or not, like early in conception and implantation, you can dissolve an embryo in high dose digestive enzymes.
That kind of makes,
So I
mean,
no
unless someone had like
nattokinase, no
exocrine,
digestive
if someone
enzymes.
had exocrine pancreatic insufficiency and they needed it, then I mean, just medically.
Yeah, then it's kind of a cost benefit. But I'm personally not comfortable. I'd rather do apple cider vinegar to help you with digest. Ginger, as Dr. Wong mentioned.
Got it. Help the stomach acid. How about herbs? Any safe herbs in pregnancy, or herbs for fertility in general? I know that's a very general question, but
yeah, so you have to be careful of herbs. So the way I would say is, if you're working with herbs, don't just order something and take it. Work with a practitioner, because there are a lot of herbs that are contraindicated in pregnancy. So even sage, peppermint, some of these things have been shown to increase risk for miscarriage. So you want to be really careful with herbs. So Vitex chasteberry is kind of well known in the first 3 months to be used for hormonal balance. You also want good quality products. So ordering through a practitioner, because there's a lot of products out there that have contaminants in them, and herbs can be a source of that. So you want to make sure you're using good products. Rhodiola has been shown to be safe in pregnancy, but I'm generally really careful with herbs, and I focus more on the nutrients.
About that too. I agree with that. Well, thank you so much, Annina, for coming on. It's great to see you. And again, Annina's practices Simplina Nutrition, which sounds to me like a really a good tasting pasta, but that's a great nutritional practice.
Gluten-free, right?
Gluten-free pasta, yes, exactly. I hope you and your family are doing well, and we will catch up soon.
Okay, thank you. Thank you, Dr. Wong, and thank you to all of those who listened today.
Thank you. All right, see you later.
Bye.
Bye.